How do you feel great on vacation? Like really good? Easy. You go to Aruba. You'll spend your time relaxing on cool white sand beaches and floating in healing blue water. You'll immerse yourself in natural wonder and find your center on an island where things move at your speed. You won't just feel great, you'll feel relaxed, renewed, and ready for life. That's the Aruba effect. Plan your trip at aruba.com.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked question that pediatricians regularly receive in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatric bestie, Dr. E. Tay, a pediatric emergency medicine physician in New York City. All right, so today we are going to talk about things that a pediatric emergency medicine physician does not buy or do with her own kiddos as an emergency room attending. The clock is ticking, so let's get to it. All right, E, let's kick things off with some context. Do you have kiddos of your own? And if so, how old are they?
So I have 3 kids. One's 9, 11, and 13 years old.
All right. So are there certain products that are an absolute no-no in your household?
So it was much easier to screen it when the kids are younger. But now when they're older, things change. So we would never own guns in our house. That's just a big no. And some of the other things that people don't think about is blinds. We live in New York City. We have blinds rather than curtains because I work in the ER. I sometimes sleep during the daytime, so I need blinds to have a complete blackout. But we don't have blinds with cords. So I think that cords are extremely dangerous for kids. They can wrap their head around it. They can wrap their limb around it. It's a risk for suffocation, so we just don't have blinds with cords. We also mount our TVs and our shelves onto the wall itself because we do see a lot of injuries of those type of furniture that topple over. So that's one thing that we always do. And we always have our kids wear a helmet if they're in some sort of a wheeled vehicle.
All right. Wow. You're describing things that are obviously parents' worst nightmare. And I can't imagine the things that you've seen in the ER. So that's really impactful. E, are there certain activities that you would make sure your kids avoid?
So I would never, ever have my kids go on the trampoline park. It looks fun and all, but once the trampoline park starts around the surrounding orthopedic clinics, they gain their own business. You see a lot of broken limbs. You're just not safe in that area, in my opinion. Oftentimes when you have a little kid's jumping right next to a large child, then the large child will fall into the little kid. I just don't think it's a safe environment. And I would also not have my kids go on an ATV. A lot of the ATVs are just really not safe. Sometimes they don't really have a helmet. They go up on a hill. If they're not caged in, they can fall over. There have been a lot of incidences and deaths associated with ATVs. So that's another thing that we won't do.
Oh boy. Okay. What about things like swimming or any foods not to eat, anything like that?
So swimming unsupervised is a big no-no. Any pools that you are going to be living near with, I would definitely suggest you have a fence, a child-proof fence associated with it that surrounds the pool. And then you always keep an eye on where your child is at all times. For the younger kids, I really worry about aspiration associated with certain foods such as popcorn. People don't think about this when they're eating the popcorn and then they may choke on it, but popcorn is kind of like a sponge, so it can expand in your lungs and they can actually cause blockage with air going in. So that's a big no for the younger kids. I don't like hard candy for that same reason, to aspirate and you can choke on it. And we've seen patients who actually had a lot of difficulties with whole grapes and hot dogs because they're just solid. They don't really necessarily melt. So I find that to be extremely dangerous if you don't cut it up for the younger kids.
Interesting. So let's talk about the flip side. Are there certain items that are an absolute must? And you've already talked about a few of these things, but probably worth reiterating.
Yes. So we talked about the helmets. All the kids wear a helmet, and we talked about the fencing around the pools. I want to reiterate that. any body of water, even if you can stand up on that pond or that lake, I would suggest also wearing a life jacket if you're going to be near any part of water, only because you just don't know everybody's swimming abilities. And so it's really smart to have a life jacket if you're going to be on a boat, if you're going to go sailing, and if you're just not sure of your swimming ability. Seatbelt is always a must. Definitely wear a seatbelt because we know that it saves lives. And I always have a 1212 poisons or your local poison control phone number on the refrigerator. And I tell the kids where it is. Because if you ever run into an issue or a problem and you have questions, not only regarding to your children, your pets and whatnot, that's always a good resource to have. And finally, definitely wear sunscreen. It can protect you in the future.
And what about like outlet covers?
Outlet covers are great. I've seen kids who take just random things and just stick it in there in the outlet covers. I just don't know why that's a fascination. And so outlet covers are not only for inside your home, but also public areas. I've convinced my building to put outlet covers on the hallways because sometimes kids do play in the hall. And so I think having outlet covers around the public area is also a good thing.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. E. Tay for sharing her expertise with us today. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.